turn it down.
Okay, welcome everyone to this special webinar event for the Rural Health Association of Utah. We're pleased to bring you a presentation today titled Rural Health Access for Veterans. My name is Casey Shakespeare. I serve as Executive Director of the Rural Health Association of Utah. And before we begin, being that it is Veterans Day, I would just like to express my heartfelt gratitude for our veterans. Both my grandfathers served, 3 of my uncles did. I have a cousin who just retired from military service with 2 Purple Hearts and had served, I think, 4 tours of duty in the Middle East. And I have a lot of friends and family that have served, and I truly appreciate their service and sacrifice to protect our freedom. And today holds a special place in my heart. So we're very excited to introduce today's speakers. We're pleased to hear from Jennifer Morgan and Wendy. How do you say your last name, Wendy?
Hanson.
Oh, it comes up as not Hanson on the screen.
Oh, I'm sorry. Maybe I kind of, I probably didn't spell check it. Sorry.
You're good. No, it says at CUCIL. So it looks like
that's,
council.
yeah.
Okay. So Jennifer is the Cover to Cover Program Manager at the Institute of Disability Research Policy and Practice. Since 2013, she's worked closely with Utah's area agencies on aging and community-based organizations to organize training on VA programs and partnership development between organizations. And Wendy Hanson is a social worker at the Ability First Utah Independent Living Center, covering 2 rural counties in Joab and San Juan. And Wendy started working with Cover to Cover program about 3 years ago as well. And so I'll turn the time over to Jennifer and Wendy, and appreciate having them join us today as our speakers.
Great, thanks so much, Casey. You can go ahead and go to the next slide. Thank you for the introduction. I go by Jen. And before we jump into the presentation, I also wanted to acknowledge it is Veterans Day and really appreciate Casey kind of allowing us to present kind of on a special webinar today. So any veterans on the call, thank you for your service. I think, as Casey said, we're all connected. Maybe we haven't served, I have not served, but I have a father, an uncle, a brother that has served. So we all have some connection, even if it's a neighbor or coworker. And so just to acknowledge that, and just to round out kind of our work, we advocate for veterans, ask them when they served, listen to their stories, thank them for their service, encourage them to enroll in VA services. They have earned and deserve these benefits. Don't wait. So we're here with our program, reaching out to rural veterans specifically to get them enrolled in VA healthcare and not to wait. So we'll run into the overview of our program, so we can go to the next slide. I'm just going to give you a little bit of background on the Cover to Cover program, our objectives, some VA navigation that I think is helpful for anybody, and then a little bit of discussion about VA healthcare enrollment. And then Wendy and I are going to have a conversation because she is actually out in the field working directly with veterans, and I think her perspective will be helpful on how this program has helped her engage with veterans in her area, which maybe wasn't happening as much prior. So, there is, sometimes they call it a big brick wall, or you go to the VA and open the door and there's a brick wall. People have a hard time getting into the VA system and understanding how to navigate it. So in 2013, the Utah Aging and Disability Resource Center, which was up at the University of Utah, was funded by the VHA Office of Rural Health. And we had about 3.5 years of funding. And our acronym is Connecting Older Veterans, especially rural, to community or veteran eligible resources. So in working at that point at the University of Utah, the VA is right across the street. So we already had some collaborative interactions. So we found out about the funding and kind of pitched this idea as we were working with area agencies on aging and centers for independent living. So agencies, helping older adults and people with disabilities. But what we knew is that they really didn't get any training on VA benefits. So next slide, we'll cover the objectives. So we train community agency staff in VA benefits and services. We invite VA staff to come to do anywhere from an hour training, 4 hours, or a full day conference. We've always had very positive support from staff to come and do a presentation. And then build relationships between the community agencies and the VA, and then create a new access point for veterans within their communities, within their rural communities. In the beginning, we weren't sure if we would be doing training and then, having monthly meetings or trying to build that partnership. But really what happened is those training events became the foundation of building the relationships, because we'd have a lot of the same presenters come, and then we started swapping phone numbers, and now we're about 12 years, we've got a lot of the same partners, and we would probably consider each other friends. So it's been a very rewarding project to be a part of. Since our funding wrapped up in 2017, we kind of found funds here and there to keep us bridged. And in 2021, we were funded by the Department of Health and Human Services, the Office of Primary Care and Rural Health, in which they were able to get an appropriation to support this program. And so hopefully we'll be doing it forever. And maybe someday we'll get more funding so we can spread into more rural areas. Next slide. So the other thing we weren't quite sure of is how were we going to get the veterans to come to our agencies. And what we found is we just changed a screening question. Instead of asking, are you a veteran? We asked, have you or a loved one served in the military? Or do you care for someone has served in the military? And we found out that veterans were already calling these agencies. In 2016, we added a data point that asked callers, have you ever connected to the VA prior to calling our agency? That year, we served 1,166 veterans, and 64% of them said they had never connected to the VA prior to calling the agency. So we knew that they were calling us and that we weren't talking about VA benefits at all, and that they weren't getting information about VA benefits. So this question really made a big difference in identifying callers as veterans. Next slide.
Sorry.
No problem.
Yeah.
And so I'm going to do just a quick overview, because I feel like, again, people, organizations, veterans, their families don't really know how the VA works, which causes a lot of frustration. So I'm just going to get kind of overview of the structure of the VA. So there are 3 federal branches. The first one is the Veterans Health Administration. So VA medical centers, clinics, healthcare, caregiver support, in-home services, those type of services. And then a different doorway is the Veterans Benefits Administration, the VBA, which that would do with anything that had to do with financial compensation, like GI Bill, service connection, compensation, those kind of things. And then there's the National Cemetery Administration, which Utah just opened a national cemetery in Cedar City. So that's so exciting. And so each of those doorways are separate. If you went into, say, some of our older veterans, will get them connected to VA healthcare. because they have hearing loss. So, you know, if they're enrolled in VA healthcare, they might be able to get hearing aids that for free. But since they have the disability with the hearing loss due to their service, the healthcare system isn't going to like triage them over to the VA Benefits Administration and say, oh, hey, you should apply for a service compensation. So each avenue, each pathway, you really are talking to kind of a different division of the VA. So that can be frustrating, but in my experience is if at least you know how it works, then you can kind of navigate it. Next slide. And then every state has a state Department of Veteran Affairs. And so we have the Utah Department of Veteran and Military Affairs, UDVMA, always have to have acronyms. So our UDVMA is a very close partner to us. They are great. They work with veterans. They employ veteran service officers. So that's the state level. I think Utah's pretty good actually working with other VAs, is that there is collaboration through the state and the federal branches, so to speak. Next slide. So oftentimes we talk about the VA. So that means a lot of things, right? Because there's all these different doorways. So we might talk to a veteran that said, oh, I applied at the VA and I wasn't eligible. Well, that needs to have another question, because you need to ask, well, what did you apply for? Sometimes, you know, veterans might go online and apply for a benefit, which they might not be eligible for in the first place. So that's why I'm always advocating to work with a veteran service officer. But anyway, they can get this perception that they were not eligible and they're never going to apply again. So anyway, the VA, our VA here in Salt Lake City, has a lot of the components here. We've got the medical center on campus. We've got the VBA, so the Veterans Benefit Administration, the State Department, as well as a veterans home. So it's a great campus. And again, I think we're lucky here because there is some collaboration. However, a veteran's still going to have to like go through each pathway to get the services that they need. Next slide. Okay, so I'm not a veterans benefit specialist. I've probably been in 5,000 hours of training, but I am not going to, I don't think anybody on the call wants to become a benefit wizard. We're really here to talk to you high level, connect you to some resources. There's going to be some active links in the slides that Casey sends out, as well as contact information to people that hopefully live in your area that you can refer or call them up and ask them questions. That's what we're here for. But I just wanted to point out a few things about healthcare enrollment. Some of the big ticket items, I think, is, you know, there's no enrollment fee, monthly premiums, or deductibles. But the big thing, which I wish I would have super highlighted on here, is freedom to use other plans with your VA healthcare, including Medicare, Medicaid, or private insurance. And I think that there is also a misconception with veterans that they think they have to choose. So they think, oh, well, I don't need the VA healthcare, I've got this other. But again, if you're eligible, don't wait, because it could supplement your healthcare plan. And, you know, it just gets more challenging, I want to say, sometimes our older veterans to get the paperwork to fill out the application. So we just encourage veterans to just get enrolled. Next slide. So how to enroll. Again, I don't think anybody on the call wants to, you know, get into this business. So we just want to make it easy. for you on how to make recommendations or referrals. You can do it online, and there's a link here that will bring up the application. By phone, 8877. I probably will put that on the bottom of the list because there's a lot of other options that might be easier. By mail, in person, they can go to any VA clinic or the VA hospital to get help with enrollment. You can call the VA healthcare enrollment line. I've got a direct extension on here. Or you can reach out to a cover-to-cover team member, and they can help navigate that process. Next slide. So here are the VA clinic access. So we're talking about rural access, and I'm going to ask Wendy some questions coming up. But you know, veterans don't necessarily have to go to the Salt Lake VA Medical Center. There are VA clinics. They used to be called community-based outreach clinics. Now they're just going with VA clinic. So there's you know, scattered throughout the state. You'll also see Nevada and Idaho as Salt Lake VA Vision covers this entire area, so a little bit outside of Utah. Unfortunately, this grade, I kind of had to cut and copy on this slide, and unfortunately, the brochure did not include the phone number. So I would just Google that if you're trying to reach out directly. Next slide. So I'm a big advocate for the caregiver support program. We work very closely with Andrew Whitwer. He's a great champion, very passionate about getting caregivers connected to support services. They're eligible, but a veteran has to enroll in healthcare. So kind of another reason why it's a good idea, because this opens up opportunities for caregivers. So there are, I put a link in here and it'll take you directly to Salt Lake City's caregiver support program. There's 2 programs. I'm not going to get into the weeds with it, but one, the general program is pretty much all caregivers are eligible for it. It's basically talking to Andrew and they sign them up. And then there's a more comprehensive program that includes a stipend for the caregiver, as well as access to CHAMP VA. Now, the eligibility for that is much higher. It requires a service connection. But again, you don't need to really know all these things. You just have to identify a caregiver that is interested in the program, call Andrew or email him directly. So it's a very easy access, and he's amazing. Next slide. Okay, this is our team. So this will give you an idea of where we are located. So Janelle Esplin, she is accredited veteran service officer through our state department, as well as Shanna Anderson. And Janelle's in 5 counties, so covering Beaver, Garfield, Iron, Kane, and Washington. Shanna's in Bear River, and she covers Box Elder, Rich, and Cache. And then we have Wendy here. I guess you cover one more county that I wasn't aware of, but I will say that Juab. She is quite an advocate, and probably if any veteran called from anywhere, she would help them. So next slide. So how do we help rural veterans? You know, we provide the full plate of options. So when they call, we can give them information about public programs as well as VA benefits. So kind of give them the full choice of options that they may be eligible for. We help veterans and their families navigate the VA system, educate on specific documents that are required to apply. So if they decided that, hey, I want to work at a VSO, you know, that's around the corner from me, we can tell them what kind of documents they would need for that meeting. how to request a DD-214. So some people at the VA will call this the golden ticket, because you have to have it or you're not going to get anything. It's separation papers, and that's required for all applications. And again, when we talked about pathways, if you apply at the healthcare system with your DD-214, the VBA, the benefit side, isn't going to have it. So you're going to have it again to apply for those benefits. We help apply for healthcare, file benefit claims. We help surviving spouses file for benefits if they're eligible. And then we follow up with the veterans to ensure services were received. And I think that, I feel like we provide a gold standard from start to finish in following the veteran and making sure they got connected. If they have questions about what do they do next once they're enrolled. We worked with a Korean veteran. We expanded the program to Oregon, and he applied for healthcare, but he never got his cards in the mail. So he just assumed that he wasn't eligible. It was like 8 years later when he worked with one of our staff persons, and they found out he'd been enrolled all that time. He just didn't know it. And he had been on a pretty expensive drug for diabetes, basically paying out of pocket that the VA would have covered. So we do the follow-up to make sure that once they're enrolled, that they know what steps to take after. So next slide. And then the State Department, I bring them up just because they really they do a lot of outreach. They do a lot of work in the community. They provide education to veterans and family members, caregivers, survivors about benefits. They're accredited as veteran service officers. They engage in outreach events to support community or veteran events. I would say that, so in the state, I don't have their map or their breakdown, though I did put a link in here for you to find your nearest VSO. But they do cover statewide, and they have a VSO for each kind of region of the state. So somebody is specifically going to cover, an area, maybe 1 or 2 counties. So they're great. I would also say that they love doing outreach events. So we do, if we have a health fair, or if we've been doing a lot of rural caregiver conferences, we can invite them to come and present, or to set up a resource table and come and talk directly with veterans in the community. So that's part of their job, and they're always excited to get out there and collaborate with us. Okay, next slide. So that's the end of my presentation of giving you kind of an overview of our program, who we are, where we are, a little bit on healthcare and rural access through the VA clinics. We're going to talk about community care today, but because it's Veterans Day, we had a lot of staff that were committed already. So you could let Casey know if that's a topic that you would be interested in us covering, or any other topic that you might be interested having to do with VA benefits and services. We'd love to provide another webinar if you're interested. So we're gonna shift over, and Wendy and I are just gonna have a conversation about her work on this program and how she works with veterans. Do you want to introduce yourself? I know she has 2 titles, but I think she probably really has like 12. She does a lot for her community, and why don't you just let us know where you live and about your organization.
Okay, thank you. And I'd like to echo first and foremost, before I get started with that I am very, very appreciative of veterans. I am the daughter I am the sister. I am the niece. I am the wife. And most importantly, I think I'm the mother of veterans. My son is 80% service connected disabled from Operation Enduring Freedom and Operation Iraqi Freedom. So I became very familiar with the veterans, the VA, helping him go through that process. But primarily, I work for an independent living center, and that is not a place where people live. It is a state and federal mandate under the Administration for Community Living, and we are charged with helping people that are disabled remain in their chosen community-based living environment. And we also help overcome barriers to that. Since I live in Sanpete County, I was born and raised in Salt Lake City. I came down here, I met my husband, who is very fond of saying he's 5th generation, and our kids are 6th. But we have even though we have a great junior college in our community in Sanpete County, we have no buses, we have no taxis, we don't even have anybody doing Uber or Lyft. So our agency provides a lot of transportation for our consumers, who include veterans. Currently, I have about 13 active veterans on my caseload. That's not a lot, but it's better than not having any. So right now we're in the throes of getting everybody to get flu shots and COVID vaccines. So, and a lot of them don't drive anymore. So that's primarily what I spend my days doing, but I really, really, really enjoy the cover to cover side of it. Before this happened today, I've spent my morning going to a couple of cemeteries and participating in the veteran ceremonies there, which I had to basically put on new mascara because I cried it all off. I just don't think that there's anything more fulfilling that I can do in my career as a social worker to help veterans. So that's what I do.
That's awesome. Yes, I knew you would probably be busy today, so I appreciate you squeezing this in. You mentioned transportation being, just a rural challenge. But
Yep.
What would you say that you have encountered in the last 3 years for this project? What the biggest challenge is for rural veterans?
Well, I guess I've thought about this a lot, and I would have to say that most of the time when I'm contacted by a veteran or their family, a lot of times it's the family, they're at a critical point. Someone is very ill, been diagnosed with a serious illness. They might have been fighting that illness for years. Sometimes we don't even know that, but they're in crisis a lot of times when they contact me, and they need, and I find out if they've served in the military, if they have another real challenge down here is people lose their DD-214. So I've become very proficient in getting that. And as the VA is becoming more and more accessible, through technology, there's a way to get that a lot quicker than it used to be. So that's a challenge. And then getting them, the help that they need in a timely manner. Sometimes, when the documents leave my hands, when I, go together, most of the time I'll take my computer out and visit with them in their home with family members. And then I have been using the Access VA. I signed up for that so that I can do the documents on my computer and then just digitally file them. I love it because I get a two-step verification that they got the documents. So I know they're in the VA's hands. But then once that happens, I can be a squeaky wheel for the veteran, and they can be a squeaky wheel, and I encourage them to do so. But, you know, it just happens in its own time.
Well, and thank you for bringing up, I meant to mention that that is a unique piece of our cover to cover model. The 3 team members we have are social workers, and that they can go to the home, because we do have homebound veterans that can't get out of their house. And the State Department of Veterans Affairs, they typically don't go into the home. So that's another kind of great part about this project, that because it happens. And that's the other reason why we're trying to get veterans to sign up now and not to wait, because it just gets harder with growing health conditions, maybe cognition, you know, just getting stopped at, I don't have my DD 214, I can't find it, I can't apply. You know, I mean, it's just to know that we have supports in the community that can help them. Okay, this comes up a lot, and I've worked with organizations, and they'll say, oh, well, I asked the veteran, you know, if they were interested in signing up for VA. My uncle was one Vietnam veteran. And it's like, no, I don't need that. And someone else needs it more. So I guess I always feel like sometimes it's more than one conversation, but I kind of like to know from you personally, like, how do you maybe encourage veterans to consider applying when they're thinking that they don't need the benefits?
Well, first of all, it's a collaboration effort, you know. A lot of times it's conversations with the family, who the veteran will be, male or female, who will be more willing to, or the veteran will be more willing to listen to them and say, oh, okay, you're right, we ought to try this. So it's just kind of, I guess on our side, or my side, being the squeaky wheel. And the thing that has really helped me for this is because I do have, my husband was drafted during the Vietnam War. Now, he did not go to Vietnam, but he did serve for 3 years, and then he came back and joined the National Guard. But my son is boots on the ground, service connected, disabled. And when I talked to them briefly about what my son has received from the VA, due to he has a combination service connected. It is physical as well as mental. And the physical side is a bigger component in his VBA benefit. But when I talk to them about particularly people that have been in areas where they used toxic chemicals, they didn't know how herbicides, Agent Orange. I had a veteran 2 years ago that it just broke my heart, because he was in Korea and he experienced just horrific frostbite, and he'd had parts of his feet amputated. And I said, you know, you need to apply for this benefit. Well, what can they do for me now? I don't have. And I said, they can do a lot. And we were able, over a period of, I don't know how long, it was probably 3 to 6 months. And we were able to get him some services that he needed, but also we were able to get caregiver support program in there to help, because his elderly wife was taking care of him. And they did have children, but they didn't have any close around. So that caregiver support program has been just a godsend to rural Utah. It's usually, well, in my case, it's run through R6, which is our Association of Government. We have association of governments all over the state of Utah, and I'm assuming in other states as well. And that has just been a lifeline, you know, just for somebody that needs to go out and, you know, they just want to go shopping on their own, or they want to go visit a friend, or they want to go play bingo at a senior, you know, just being able to. And I think that's been the niche that's helped us get the veteran on board. It's like, you know, the wife saying, hey, I want to go get my hair done today, or I want to go buy a new pair of shoes, or I want to go watch my granddaughter in her school play. And it's like, and I don't want to worry about you the whole time that I'm gone.
Yeah.
That's huge. And that's something that we not only owe the veteran, we owe their family, their immediate family. As Abraham Lincoln said, their widow and their orphan.
Yeah. Yeah, I agree. And I think that this is also, I mean, I keep saying why this program is so wonderful, but you know, the VA isn't as connected to the community-based organization. So, you know, our program, you know, Wendy's connected to a lot of other outside of our own community-based organization. So it's a way to get more benefits and services that are needed. Where what somebody at the VA may not realize what a caregiver support program is outside the VA.
Mm-hmm.
So, okay, I might have one more question for you, but I guess, Casey, I also, you know, we're probably going to finish early, but I did want to see if there were any questions.
Yeah, absolutely. It's okay if we finish early, but definitely would love to open it up to questions.
Yeah, that'd be great. And you can go to the next slide. It has our contact info on there. And again, before, I just want to say really, just as you can probably hear the passion in Wendy's voice, that, you know, Shanna and Janelle are, as well as they are very excited about the program and welcome referrals and phone calls. Like, I mean, they're busy, but this is what we're doing. We're helping veterans in rural areas get connected to their benefits.
And even if they don't live in my area, they can call me. My phone number at my office is 435-283-4949. And I will try to find where they can get help, especially if it's in Utah. I kind of know that, but I'm starting to branch out and finding other resources in other states for veterans. So we just, this is never something that's going to go away. So it just has to continue. It has to continue.
Casey, did we have any questions pop up or?
No, there's none in the chat box.
Okay. All right. Well, I know it is a busy day and I don't want to keep people too long, and hopefully this was helpful for you all. And again, we're here if you have more questions about the program, about VA benefits, concerns you have in rural areas, or topics that you'd be interested in us sending you or presenting. We're here. This is what we love to do. So.
And we'll get the recording sent out very quickly. I do recognize there's a lot of people that probably have other things going on, but there's definitely a lot of interest from people signing up for the webinar. So I assume there'll be quite a few more people that view this.
Good.
Once it goes out.
Good, good. Well, thank you for inviting us and making it happen. And hope everyone has a great day.
Yeah, thank you for joining us today. And thanks for presenting, Jen and Wendy.
Thanks. Bye-bye.
Happy Veterans Day. Thanks.